Every year, millions of seniors over 70 undergo routine health checkups, believing they're safeguarding their well-being. But what if some of these tests, often deemed essential by doctors, could lead to surgery, stroke, or even cancer? Research reveals that up to 37% of medical tests in seniors result in unnecessary treatments, complications, or lifelong side effects. Shockingly, 99% of people over 70 are unaware they're being overtested. One test, our top concern, contributes to 5% of all U.S. cancer cases, equivalent to the risk of daily alcohol consumption. This truth isn't advertised in clinics or on billboards, but it's rooted in science. Today, we uncover the 5 health checkups to avoid after 70 and their potential harm, backed by evidence. You'll be stunned by what's at number 2. Before we start, share in the comments where you're from, your age, and if you've regretted a medical test or procedure. Do seniors face too many tests? We're reading every comment and offering tailored advice. Like and subscribe for more insights. Let's begin with a test that seems harmless but can disrupt your quality of life. Bone density scans, or DEXA scans, are marketed as a simple way to assess fracture risk. They're quick, painless, and needle-free. But for those over 70, they often cause more fear than benefit. Bone loss is a natural part of aging, like wrinkles or gray hair, yet scans frequently show reduced density, even without real danger. This leads to prescriptions like bisphosphonates, intended to strengthen bones but carrying risks like jaw necrosis, a rare condition where the jawbone deteriorates, or esophageal irritation. A Journal of the American Geriatric Society study tracked over 1,200 women over 70, finding bisphosphonates reduced fracture risk by just 0.3% after 5 years, a minimal benefit. Meanwhile, side effects like digestive issues or atypical fractures were more common. Consider Rose, a 76-year-old retired piano teacher, active with no falls or pain. Her DEXA scans showed osteopenia, a mild condition, not osteoporosis. Her doctor prescribed bisphosphonates, but 3 months later, Rose suffered severe reflux and jaw pain, stopping her piano playing. We discontinued the medication, focusing on vitamin D, resistance exercises with bands, and calcium-rich foods like sardines and leafy greens. A year later, she was performing again, with stronger legs, better balance, and no fractures. A 2022 Osteoporosis International study shows lifestyle changes, strength training, balance exercises, and proper nutrition can reduce fracture risk by over 20%. For seniors without falls, these are smarter than scans. Don't let a number scare you into unneeded treatment. Next, a test that could lead to something far scarier: brain surgery. When seniors over 70 notice mild memory lapses, fear of dementia or Alzheimer's often prompts a brain MRI. These detailed scans show the brain structure, but they rarely provide the clarity patients seek. Most MRIs in this age group reveal age-related changes, slight shrinkage or white matter spots, that are normal, not alarming. Yet these findings can trigger a cascade of fear, additional tests, and invasive procedures that don't improve memory and may worsen health. A 2021 Neurology Today study reviewed 3,000 MRI scans in patients aged 70 to 85 with mild cognitive complaints. 86% showed abnormalities, but only 3% were linked to treatable conditions. That means 97% of patients faced unnecessary worry, with 12% undergoing procedures like spinal taps or biopsies based on vague results. Take George, a 74-year-old retired engineer, sharp but occasionally forgetting names or misplacing keys. His MRI showed white matter changes, leading him to fear dementia. He stopped driving and attending church, and his anxiety spiked. A cognitive test later confirmed his memory was normal for his age. We focused on sleep, hydration, and brain games like puzzles, stabilizing his memory within 3 months. Unless severe symptoms like seizures, sudden personality shifts, or rapid decline are present, MRIs for mild memory issues are rarely useful. Cognitive screening tests, simple paper-based assessments of memory, attention, and problem-solving, are cheaper, effective, and avoid panic. These tests, like the mini mental state examination, provide a baseline without the emotional toll of imaging. Studies, including a 2019 JAMA Network Open Analysis, support that age-related MRI findings are common and often benign, yet they lead to over-testing. George's case highlights how fear from scan results can disrupt life unnecessarily. The key is to start with non-invasive assessments and discuss symptoms thoroughly with your doctor. Always ask, what happens if this test shows something? If the answer involves risky follow-ups with unclear benefits, reconsider. For most seniors, lifestyle interventions, adequate sleep, hydration, and mental stimulation offer more benefit than scans. The next test, one you've likely had multiple times, is concerning for its high false positive rate and potential to lead to unnecessary heart procedures. Cardiac stress tests are common for seniors reporting vague symptoms, like fatigue or chest discomfort, aiming to detect blocked arteries. But after 70, they often do more harm than good, especially without clear heart disease symptoms. The issue lies in accuracy. Studies show a 40% false positive rate in this age group, meaning the test flags problems that don't exist. This leads to angiograms, stents, or bypass surgeries, which carry risks like bleeding or kidney injury. A 2017 JAMA cardiology study found over half of stents post-stress tests offered no survival or quality of life benefit. Let's explore a case that illustrates these dangers and why safer alternatives exist for seniors over 70. Cardiac stress tests monitor heart function during exercise or medication-induced stress, often ordered for seniors over 70 with mild fatigue, chest tightness, or feeling off. The goal is to identify blocked arteries, but the test's high false positive rate, up to 40% in this age group, makes it risky, especially without clear heart disease symptoms. False positives lead to invasive procedures like angiograms or stents, which carry significant complications. A 2017 JAMA cardiology study found that over half of stents placed after stress test referrals were in patients with no significant symptoms or benefits, yet they faced risks like bleeding, kidney damage from contrast dyes, or prolonged hospital stays. Raymond, a 75-year-old retired postman, walked daily but mentioned tiredness on hills during a checkup. His doctor ordered a stress test, which yielded unclear results. A catheterization followed, revealing mild artery narrowing, and a stent was placed. That night, Raymond suffered a contrast dye reaction, developing kidney problems requiring a 6-day hospital stay and weeks of follow-up care. His fatigue was due to dehydration and inadequate rest, not a heart issue. For seniors over 70 without classic cardiac symptoms, chest pain during activity, shortness of breath on exertion, or significant energy loss, stress tests can cause more harm than good. A 2014 JAMA internal medicine study on percutaneous coronary interventions supports this, showing no survival benefit for stable patients. Safer alternatives include a resting EKG, which monitors heart rhythm without stress, or a coronary calcium scan, a low-radiation test detecting plaque buildup. These are less likely to trigger unnecessary interventions. Raymond's case underscores the need to question stress tests and explore simpler options. Always ask your doctor, what's next if this test shows something? If the answer involves procedures with unclear benefits, pause and discuss. Lifestyle changes, hydration, balanced diet, and moderate exercise often address vague symptoms better than invasive testing. The evidence suggests that for asymptomatic seniors, stress tests are overused, leading to a cascade of interventions that don't improve outcomes but increase risks. The next test might surprise you. It's a common screening procedure with a harsh preparation process and serious complications, especially after age 75. Colonoscopies are widely recommended for colorectal cancer screening, but for seniors over 70, the risk can outweigh benefits unless specific symptoms are present. The preparation involves strong laxatives, and the procedure itself carries risks like bleeding or perforation. A 2019 JAMA internal medicine study highlights a stark risk-to-benefit ratio, showing why this test is concerning for older adults. Let's dive into a case that illustrates these dangers and explore safer alternatives that can still protect your health without the risks of invasive procedures. Colonoscopies, using a camera to examine the colon, are a gold standard for colorectal cancer screening. However, for seniors over 70, especially those over 75, routine colonoscopies can be more harmful than helpful unless symptoms like bleeding or stool changes are present. The preparation process is grueling, requiring strong laxatives that can cause dehydration, dizziness, or kidney problems, particularly risky in older adults with comorbidities. Sedation during the procedure can impair brain function, and complications like bleeding, bowel perforation, or heart rhythm disturbances increase with age. A 2019 JAMA internal medicine study of 1.3 million Medicare patients aged 70 and older found that for every 1,000 colonoscopies in those over 75, only 2 lives were saved, while over 20 faced serious complications, a 10-to-1 risk-to-benefit ratio. Many polyps found are small and slow-growing, and removing them in seniors can cause more harm than leaving them, as the procedure's risks escalate with age. Dana, a 73-year-old grandmother running a bakery, had no symptoms, no bleeding, no stool changes, no family history of colon cancer. Her new doctor, fresh from residency, urged a screening colonoscopy. During the procedure, a small polyp was removed, but that night Dana experienced severe abdominal pain and fainted. A hospital visit revealed a bowel perforation requiring 9 days of recovery. She lost 10 pounds and struggled afterward. Her records showed 2 prior clean colonoscopies, making the repeat test unnecessary. The U.S. Preventive Services Task Force, USPSTF, recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based FIT test, non-invasive, done at home with no prep or sedation, is a safer alternative, catching most concerning cases. Dana's case highlights the need to question routine colonoscopies and explore less invasive options like FIT tests, which have high sensitivity for detecting colorectal issues without the risks. The evidence suggests that colonoscopies should be reserved for seniors with specific symptoms or high risk, not routine screening after 75. Always discuss your health status and life expectancy with your doctor to determine necessity. Once in the colonoscopy pipeline, follow-ups can spiral, making it hard to step back. Our final test, the most overused and dangerous, is often marketed as a preventive must-have. It involves high radiation exposure and a surprising cancer risk, making it a critical concern for seniors over 70. Let's explore why this test tops our list, how it leads to unnecessary procedures, and what you can do to protect your health without falling into the trap of fear-driven screening that could leave you worse off than before. Annual full-body CT scans, often promoted in executive health packages or private clinics as a way to catch cancer early, are the most overused and harmful tests for seniors over 70. These scans deliver high doses of ionizing radiation, 10 to 20 millisieverts per scan, equivalent to about 500 chest x-rays. A 2025 JAMA internal medicine study projects that CT scans could contribute to 5% of all U.S. cancers, matching alcohol as a cancer risk factor. That means 1 in 20 cancers may stem from a scan meant to prevent disease. A terrifying irony. There's no evidence that routine full-body scans in asymptomatic adults save lives, yet they frequently detect harmless nodules, cysts, or calcifications, normal aging findings, that trigger unnecessary follow-ups, biopsies, and surgeries. The American College of Radiology advises against these scans for general screening due to significant risks and no proven benefit. Marcus, an 80-year-old martial arts instructor, was active and healthy. He opted for a senior elite checkup, including a full-body CT scan, which revealed a 3-millimeter lung nodule. This sparked a chain reaction, an oncology referral, a PET scan, and a needle biopsy. The nodule was benign, but the biopsy caused a partial lung collapse, requiring hospitalization and a 2-month recovery, all for something that could have been left alone. The 2025 JAMA internal medicine study estimates 103,000 future cancers from 93 million CT scans in 2023, highlighting the radiation risk. Seniors with cells more vulnerable to radiation damage face higher stakes. These scans often flag benign findings, leading to a cascade of interventions that cause more harm than good. Targeted imaging for specific symptoms like unexplained weight loss or coughing up blood is appropriate, but broad, unfocused scans are like searching with a landmine detector. You might find something, but the harm could be worse. Instead of routine full-body scans, prioritize regular checkups with your primary doctor, focusing on indicated tests. Listen to your body. If you feel well, avoid fear-driven screening. Always ask, what's next if this test finds something? If the answer involves unclear benefits or high risks, reconsider. The evidence is clear. For asymptomatic seniors, full-body CT scans offer no advantage and significant danger. Our final section summarizes these insights, offering practical steps to stay healthy and make informed medical decisions. Ensuring your health choices prioritize quality of life over unnecessary testing that could lead to complications or distress. The 5 health checkups, bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans may seem prudent for seniors over 70, but they often bring more harm than help. Research like the 2019 JAMA Internal Medicine study on colonoscopies and the 2025 study on CT scans shows these tests can lead to unnecessary treatments, complications, and even increased cancer risk. Rose's jaw pain from bisphosphonates, George's anxiety from MRI results, Raymond's kidney issues post-stent, Dana's bowel perforation, and Marcus's lung collapse highlight real-world consequences. These tests disrupted lives without clear benefits, driven by routine screening rather than symptoms. The key is individualized care. Tests should align with your health status, symptoms, and life expectancy. True prevention starts with lifestyle, not scans. A 2022 Osteoporosis International study showed that strength training, balance exercises, and proper nutrition reduce fracture risk by over 20%. For memory concerns, cognitive tests like the mini mental state examination are safer than MRIs. Resting EKGs or coronary calcium scans are better than stress tests for heart health, and FIT tests offer a low-risk alternative to colonoscopies. Always ask your doctor, what happens next? If the test findings lead to unclear or risky interventions, pause and discuss alternatives. Shared decision-making ensures your health choices prioritize quality of life. The evidence supports a less is more approach for seniors over 70, focusing on staying active, eating well, sleeping deeply, and choosing tests wisely. We want to hear from you. Have you or a loved one faced complications from an unnecessary test? Share your story in the comments. Your age, location, and experience help us tailor advice. We're reading and responding with personalized tips. For example, if you're facing pressure for bone density treatments like Rose, ask about lifestyle options. If you've had a test like Marcus, discuss targeted imaging with your doctor. Your voice matters and your experiences can guide others. Like this video and subscribe for health insights that cut through the noise. Backed by science and focused on thriving. Let's move away from over-testing towards smarter, safer choices. For seniors over 70, the goal is to maintain health without fear-driven screening. Regular checkups with a trusted doctor, focusing on symptoms and evidence-based tests are key. Avoid tests with high risks and low benefits, like those discussed. By prioritizing lifestyle, exercise, nutrition, and sleep, you can reduce risk without invasive procedures. Stay empowered, question routine tests, and work with your healthcare provider to make decisions that enhance your quality of life. Thanks for watching, and let's keep the conversation going in the comments to support each other in making informed health choices.